Hello and welcome to the show today, Women's Health and Vitality Unleashed. I am your host, Coach Dr. Ann Hester, double board certified physician, and the creator of the PatientWorld.net on-demand health and wellness course platform. And today I'm excited to have a special guest. Now, all you women can really relate to this. We have Miss Maressa McKee, and she's going to talk to us about something that a lot of people probably wouldn't know, but you want to know about it. So, Maressa, tell us about yourself.
Hi, everyone. So I've been a body worker, licensed massage therapist, and cranial sacral therapist for the past about 14, 15 years. And over the past couple years, I started on my own pelvic floor and core healing journey, which led me to a variety of methods, including one that I'm now certified to teach called Restore Your Core. And it's been a game changer for me and for my clients, and is a great way to reverse and heal symptoms associated with pelvic floor and core dysfunction. So that's now what I teach through movement and one-on-one assessments, and I'm glad to be here. Thanks for having me.
That was my pleasure. So, what are the main contributing factors to pelvic floor issues?
Yeah. So, I mean, there's a lot, obviously. There's hormonal factors, there's lifestyle and stress, and those are kind of the big ones. Through the lens that I look through as a massage therapist and a movement teacher, the main contributing factors that we work on in sessions and in courses is really mitigating intra-abdominal pressure through how we breathe when we work out, which really takes away from pressure on the pelvic floor and the pelvic organs, and also helps to relieve stress as well in those areas, as well as nervous system reactivity. So that's a big chunk of the work that I do with people is helping people to retrain their core and their pelvic floor and how they're engaging,
Mhm.
so that they can kind of engage more reflexively instead of being either too tight or too lax. And we do that through movement and breath.
Okay, sounds good. So, how can women help themselves if they're struggling with core issues or pelvic floor problems?
Yeah, so again, it can always be great to go see a doctor or a physical therapist to get any kind of diagnosis that you may need in regards to maybe hypertonic pelvic floor, tissue tension, and that kind of thing. Professional help is always great. However, what you can really do at home for yourself is to start paying attention to how you're moving. You can do exercises and breathing techniques and, stress release, basically, that helps you to get more in touch with your body, so that you can really feel and become aware of what's going on with your tissues in your pelvic floor. I find that, we can be very cut off from sensation in our pelvic floor and in our lower abdominals as women for a variety of different reasons, whether that's from C-section, pregnancy, trauma in that area. So the first step is really to gain awareness for yourself and what's going on in that area. And from there, you can either find professionals that can help you, or the information that can help you to mitigate what you're sensing in those areas.
Okay. Let's talk about breathing. What is
Yeah.
the function of breathing in all of these issues?
Yeah, so one thing that was a big, mind blower to me, even after having received a lot of training as a massage therapist, is and in other modalities as well, as I was never taught how the core, pelvic floor, and your breath works together as a coherent unit. And so, how you breathe while you're engaging your core is really determines, again, that intra-abdominal pressure and how well your pelvic floor is going to respond in your core. So if you think of your core as a canister with your diaphragm, your breathing diaphragm as the top of the canister, and your pelvic floor as the bottom of the canister, they're both diaphragms. So as you inhale and your lungs expand, your breathing diaphragm moves up into your rib cage, and ideally, your pelvic floor descends simultaneously. And then as you exhale, ideally, what is happening or should be happening is that the opposite occurs. the diaphragm in your rib cage descends and your pelvic floor lifts. And so as you're breathing, there's this contraction and release happening, which mitigates intra-abdominal pressure. Now, most of the time, we're taught to belly breathe, which can be great for relaxation or for when you're just laying down. But when you're trying to strengthen your core and heal pelvic floor issues, belly breathing can often increase that intra-abdominal pressure, and that looks and feels like bracing. So, like if somebody is going to punch you in the gut and you kind of brace in response, or bulging, like if you are doing Pilates and you're doing a crunch or a double leg lift, your belly can't help but push out in order to try and assist in that move, or bearing down into the pelvic floor where more pressure is being placed on the pelvic organs and the pelvic floor, usually often more than the pelvic floor is equipped to handle. So that those are all the things that really contribute to prolapse and incontinence and tension in the pelvic floor. Other sensations such as like bladder issues that can mimic UTI symptoms and sensations. So again, the breath is so important when we're trying to retrain and rehab the core and pelvic floor, so that we're mitigating that pressure system and helping it to retrain to work in its physiologically optimal way. And so we do that through breathing. So as you exhale, if you're going to be doing an exercise to strengthen your core, you want to exhale by drawing in your lower abdominals, which engages your deepest core muscle called the transverse abdominis, which acts as like a corset around your spine and your abdominal organs, pelvic organs. And when we engage that when we're doing core exercises, we help to support the positioning of your pelvic organs and also help to stabilize your lower spine and your pelvis. So, and that sets you up for a good foundation so that you can start to mitigate any potential unwanted symptoms that you're experiencing.
Okay. So, what exercises should we avoid?
So, as I was saying, with the bulging, bracing, and bearing down, basically any exercise where you can't help but brace, bulge, and bear down are exercises you want to avoid, especially if you have diastasis, which is the separation of the core muscles, prolapse, which can be bladder, uterine, rectocele prolapse. If you have hypertension in the pelvic floor tissues, we don't want to do any exercises that are forcing your muscles to brace, bulge, bear down, which increases that intra-abdominal pressure and that downward bearing into the pelvic floor and compression of the pelvic organs. So any exercises that force you to do that, you want to avoid. And often what I find with clients is that it takes time to really retrain your core and your pelvic floor how to respond, and to, be more of a reflexive dynamic unit so that when you're lifting up your kids, or you're doing just daily household activities like, putting something in the oven or doing your laundry, that you can use this breath of exhaling, drawing in your lower abdominals to activate that transverse abdominis, to mitigate the extra pressure in the pelvic and the core region, to assist you in basically anything functional that you need to do in your life.
Okay. So,
Yeah.
how long does it take to flip the switch, to turn things around once
Yeah.
women get started in this sort of program, these activities? What can they expect?
So it really depends on the person. It depends on your lifestyle and your stress levels, because stress can really play it's a big factor in, just, your tissue, whether you're clenching, whether you're gripping in response to stress in your life. Um, Often, I think as mothers, we can be in kind of like a hyper vigilant state a lot of the times, and what I see is that, and for myself included, that can really transfer into a pelvic floor gripping, or like a glute clenching, which is also a symptom of the core not being in a place of strength or ability to handle the load that we're asking it for. So it can take time. It's also important to look at your alignment, because the positioning of your pelvis can really determine how, if your core muscles are in a place to be able to engage. If you're I'm trying to show myself in the camera now, if your pelvis is tipped forward, an anterior tilt. So it's like if a bowl of soup, your pelvis was a bowl of soup and it was tipped forward, then what happens is that your core muscles elongate and they're in a constant stretched out position. So we need to take a look at alignment and make sure that, we're strengthening neutral pelvic alignment so that those abdominal muscles are neither overly stretched or overly contracted and they're in a neutral state and are ready to respond to the task at hand. So for me personally, I had a pretty significant tilt in my pelvis and a variety of other pelvic floor symptoms, including stress incontinence. And I'd say with dedication to exercises, body awareness, and mitigating stress in my life, that it took me about 6 to 8 months to really be like, oh, yeah, I'm a lot stronger in my core. I am not peeing when I sneeze. But it was, a definite, I could feel the progress happening. And it was really great when I finally felt like a lot of those symptoms I was experiencing reverse. And I have clients who come in with a lot of different lower back issues, like bulging discs. And for them, if you're in a more acute injury phase, then it can take a lot longer because you need to be going really low and really slow and being mindful of how your body's responding to the movements, so that you're not going beyond where you haven't yet begun. Right? I think that that's so often with people. We go too fast and we want to get to where we want to go as soon as possible, right? Because we want to feel good, and I totally get that. But you're going to get there in a way that's sustainable if you take your time, and you're regulating your nervous system in the process, and you're building strength slowly. And that's how you're going to get there. And it's going to take time, as it does with any soft tissue stuff. But you will get there, and many, many women will attest to that.
Mhm. You mentioned incontinence, and I think that a lot of women assume that once they get to that point, the only option is to wear, these special sorts of pads, the special sort of underwear. But
Right.
there is another way. There are things that can be done, whether it's surgery or the things that you're talking about. And that's significant, particularly when women don't want to go out in public because they get embarrassed. They
Yeah.
don't want to take the diuretic for their heart failure or for the blood pressure because they don't want to end up urinating someplace and they smell bad. And so
Totally.
this is really a very important issue. And it's an issue that a lot of people don't want to talk about because they may find it embarrassing. But it's also important for them to understand that there are options, that they don't have to just suffer in silence. And there are things that
Absolutely.
they can do to try to get their life back on track. So thank you so much
Yeah.
for what you do.
Yeah, absolutely. Yep, yep. Nobody has to suffer. These symptoms are not set in stone, and there's a lot that you can do to help yourself and get into a place where you feel more confident out in the world and doing the activities that you love to do.
Certainly. So how
Yeah.
do you want people to reach out to you? You want more information?
Sure. Yeah, so you can head to my website, which is www.maressafondramckeelmt.com, which I think is down there in my little title, except the .com is cut off a little bit.
Yeah.
So you can find me there, or you can send me an email at mfonlmt@gmail.com. I do offer Zoom virtual one-on-one pelvic core alignment assessments, as well as classes and even bespoke movement classes. So if you really like that one-on-one, and yeah, so I offer classes in group settings as well as one-on-one. So I look forward to working with you.
Okay. Sounds great. And thank you
Awesome.
again for your time.
Thank
And
you. Thank you
bye bye,
so much,
everybody.
Anne. Bye.
Bye bye.